Okay, it's started.
We're on?
We are rolling.
We're rolling. Alright, so we'll start with how are you feeling right now?
Oh gosh, more burnout than I expected to be. Now for whatever, I can't pinpoint exactly why, but it just seems like maybe little things add up over time and then they just slowly wear you down and you don't even notice it's happening. And so I guess maybe it's a culmination of all those things. And, I realized, a month ago or so for the first time that there was a glimpse of that I don't really want to do medicine anymore. And that's the first time that's happened to me.
So that kind of leads into what is your definition of burnout?
All right, so burnout to me is, I would say that most people who go into medicine enjoy medicine, right? That's probably one of the main reasons they're in it. I would say it's when you really start realizing that medicine may not be what you want to do. And it's just this feeling like, you don't want to be there. I think that for me is what burnout is. And that's scary, because that's what we're doing for the rest of our lives.
Mm-hmm.
And if this is how I'm feeling after, a couple of months of, rotations, I don't know if it'll get better. I'm hoping it'll get better. So.
Do you know what led up to burnout for you or kind of what triggered it?
So like I said, it's a bunch of little things that maybe I don't realize. It was just, I think this constant pressure of having to please everyone. It's just, am I doing this right? Am I doing this right? Am I doing this wrong? Why isn't my faculty member saying anything? Or if he does say something, you just feel really bad at the very end. And you can't voice any sort of complaint that you have. You can't go to your faculty member and say, I want you to do this, I want you to do this, or I don't want you to do this. You're not in control of anything.
Who keeps you sane in medical school?
I would say that out of all the people who keep me sane, it would have to be myself. Just because everyone else is dealing with their own stuff. People in medical school, they're always, they're doing the same thing as you, so they understand what you're going through, but they're always busy, right? People are busy. You don't want to burden someone with the same problems that they're going through. And then at the same time, if you talk to people who are outside of medical school, they don't really understand what you're going through. You're the only person that you can rely on to kind of keep yourself in this position where you burn out less slowly, or you don't burn out at all, but I don't think that's possible. Besides that, I definitely do have some friends. One particular friend back in Dallas, he's a good high school friend of mine. We don't talk about medical school related things, okay, but we just kind of send each other memes and other funny things, and that kind of keeps me going at times. So it's not like you have to talk to people about what you're going through. It could just be the smallest things.
What's your experience with ego in medicine?
Ego?
Yes, both personal and
oh my.
around you.
I think that people in the medical profession have way more of an ego than most other professions. No matter what you really say, you're obviously very proud of being in medical school, being in one of the top careers. And so it's because of that, it's people's egos constantly clashing with each other. And so it's just kind of like, you want to be right all the time, but you can't be right, and you need people to correct you when you're wrong. And some people just really can't take that. Because of that, it kind of makes patient care a lot worse. If you do the wrong thing, it's not about you, it's about what happens to the patient. Ego is not something that we can control, but we can definitely minimize. We can realize that we have a certain level of pride, but also put our pride behind us when we're treating patients and their lives are on the line. It's not about you, it's about them, and that's why we're here.
Have you come against your own ego?
You compare yourself constantly to other people, and I don't know if it's because we're so low on the ladder that the only people that you can pick on in your minds are fellow students. When other people they know stuff. It's also, yeah, if they know stuff, the first thing that pops up in my head is, where did you learn that from?
Yeah.
You know, was that from you, Will? Or where did you get that information from? Are you reading outside? What are you doing? Am I not doing enough? And it's just like, it's a horrible train wreck after that. Which is why every single time I say something that I think other people won't know, I always cite my resource at the very end of it. Not in an official way, but I'm like, oh yeah, by the way, I got this from this. It's no big deal. You can go read it if you want. So
That leads into what's your experience with feeling inadequate in medical school?
Yeah, I don't feel inadequate. I'm just kidding. Definitely every day. You come off of step 1, you feel really smart. You know, you're like, oh my God, I just like read through first aid, 2, 3, 4, 7, 10 times. And then you walk into 3rd year and you're like, I don't know anything. How do you actually treat patients? 2nd year, you're just like, oh yeah, what do you use to treat this? Oh, you give this medication, but how much of that medication, what between the different types of medications, which one do you prefer and in what kind of patients, and what are the interactions with other drugs? And it's just, obviously that's just one example, it's just medications, but you can't know everything. That's why you feel inadequate, because you realize that there's a summit that you have to surpass and you will never reach that summit. Even in the future when you're a faculty member, things are always evolving, new treatments, new guidelines. And so, when are you going to stop feeling like you can, rely on yourself? I think is when you start realizing that you are no longer inadequate, when you can trust yourself to make these types of decisions that will potentially save the patient's life. But also, it's when you, like you said, when you're comparing yourself to other people and people, around you are doing better than you, or, they know things that you don't know. During my last month of internal medicine, I had no other students with me. It was great. I had no one to compare myself to, and thus I felt so free.
Mm-hmm. So if someone says something that you think is really smart that you wish you thought of, or like they say that they're doing all this stuff that you didn't know people did outside of med school, what would be your thought process to make yourself feel better?
It's not a process that happens in the moment, it's a long-term process. So I think it's just coming to terms with the fact that you are who you are, and you can only study at a certain pace, and you can only absorb knowledge at a certain pace. And if you let what other people know get in your way, then you kind of lose motivation to study or to learn stuff on your own. I think the most important thing is realizing that you need to do things at your own rate. No matter how long that takes. Don't compare yourself to what other people are doing.
Okay, so shifting to a more positive note. Can you describe a moment during your journey when you realized that you belong in medicine?
So I'll just talk about the first time that I had a patient who truly appreciated my presence. It's not really like I did much. It was a patient who had I think a premature rupture of membranes at maybe 22 weeks or 21 weeks. So it was extremely early, and she was obviously very scared of what was going to happen. Babies aren't viable at that stage. So, I kind of just walked into the room, and I spent a good hour or so just kind of talking to them, kind of trying to explain to the best of my abilities, what was going on. What are we going to do for you? We have to give you this and this, antibiotics, steroids, stuff like that. I think that really helped them. But I think it's just how appreciative they were, You can still make a lot of change. And I think for me, the big part of that is patient education.
Mm-hmm.
You know, what can you really do in terms of treatment? That's not really up to you, you know. But what you can do is spend the time to talk to your patients and inform them about their conditions, the treatment, and just kind of just to be there, because sometimes, you know, residents and doctors, they don't have time to do that. I don't look forward to the day when I won't have enough time to do that, because I can't imagine just leaving a patient in a room and then they're scared as hell and you're not doing anything about it. You're just walking out.
Mm-hmm.
You know, for me, what was the question again? Being able to spend those extra couple of seconds and just be there for the patient. I think that's what makes it worth it. You know?
What is the culture of medicine? From your experiences?
Culture of medicine.
Yeah.
It's a balance between keeping your own sanity, plus providing the best care for your patients, plus money. Obviously, there's no way you're gonna have all three at once, right? If you want money, then you're gonna have to see, if you're an outpatient clinic, if you want more money, then you're gonna have to see more patients, and then that's gonna drain you, and so you're not gonna be able to keep your mental health. I think for medical students, one of those things is not there, right? We don't have money. So all you get is just, you know, you walk into the room, you try to take care of the patient the best you can, while at the same time, you know, having enough energy to take care of yourself. That's extremely difficult, I think. I think that people who go into medicine just for money are some of the dumbest people around. Just because you don't really realize what you have to go through. It's not just the volume of time that it takes, you know, it's the amount of effort you have to put in to each single day to just keep going. I'm not trying to paint a really bleak picture, this is just how I feel right now.
Mm-hmm.
And I know it'll get better.
So I know this is the morning after your internal medicine shell,
Yeah.
so you probably aren't thinking about next semester yet. But
Mhm.
do you have a game plan or like way you want to change your perspective going into next semester?
I think one thing that I have thought about is to stop doing so much. You know, it's because a part of me is always trying to learn as much as possible. Every single rotation, I have this thing planned out where I'm like, okay, I'm gonna read this, and I'm gonna read this, and I'm gonna reread both of those things. And I realize that now, finally, after 3 rotations, that I can't do that. Like, there's just no way I can finish everything. And I feel like for every single one of those rotations, I didn't completely finish studying, quote unquote. Mm-hmm. In the future, I need to set a more reasonable goal for myself. I have to realize I'm just a human, and that I only have certain hours in the day that I can devote to studying. In terms of my mindset, I don't really know. I think I'm really relying on this 1 month break that I have to kind of just wash away everything, and then I'll start anew next semester. Yeah.
So how are you feeling now?
Oh, after I've said everything. Okay.
Yes.
I do feel better. I do feel like I haven't really talked to anyone about this type of stuff in a really long time, and just to be in a place where I can at least say what I want to say with people who, you know, who do understand what's going on. Yeah, I think that a burden has been lifted, and yeah, I really appreciate this.
Thank you.
Yeah, thank you so much. That was
yeah,
awesome.
no problem.
That was good.
Yeah, no, that was
I
really
like
good.
that.